Right. Hello, everyone. I am Jasmine Black, one of the enrollment specialists for McKendree Worldwide, and we are doing a video series featuring some of our faculty and our student service specialists. And so today I am joined by Dr. Don Hankins. How are you, Dr. Hankins?
I'm great. How are you doing?
I'm doing fantastic. Thank you for taking the time out of your busy day to talk with us. We really appreciate it.
No problem.
Well, as you can see, we're conducting our interviews remotely. As McKendree continues to do its part in our social distancing. So, if you're ready, we'll get started.
Go ahead.
All right. So, can you tell us a little bit about yourself and the programs you oversee?
I am born and raised in St. Louis. Actually went to a small private undergraduate college, very similar to McKendree. Went on to get my master's, worked at the college level as faculty and providing medical services as an athletic trainer. Worked through 2 different colleges, then came back to St. Louis to work in the clinic setting for about 8 or 9 years. Got the itch to come back to higher education. Went back to St. Louis University to get my PhD, and then started applying to colleges and universities. And lo and behold, McKendree came open. Really liked the campus, the community, and it was close to where I lived in St. Louis. So decided to go ahead and apply and got the job. My job was to come in and start a undergraduate program in athletic training at that time, and to work to build that program along with several other majors. And that's kind of what I've been doing ever since.
Cool. So, how long have you actually been with McKendree?
This is the question that makes everybody go, wow, because nobody does that. But ironically, there are a number of us at McKendree that have stayed for quite a while. I'm actually finishing my 24th year.
Oh, wow.
Exactly.
That's awesome. Well, I know there's something to be said about, I think, having, longevity at a
Right.
place and kind of what that can really do for the students. So that's cool. So I think we've all had to adjust with COVID-19 happening, but what have you done to kind of adjust your lessons and kind of your teaching style since we've made changes due to COVID?
Well, I think one thing is that I do miss seeing the students. It's oftentimes remotely they don't leave their videos on, and so sometimes I can't always see their face, which I would be able to see face to face if they maybe don't understand something. But we're using Zoom, and this week and next week I'm actually scheduling additional optional Zoom meetings, just if they have any additional questions. In the one class, they're doing a case study. So I want to make sure that they have plenty of opportunity, if they don't feel comfortable in the class Zoom meeting, to be able to, discuss any questions they have. I know students are challenged maybe with internet connection and maybe not having a solid connection. So I've given them my cell phone number. They can text their assignments, take pictures, text them to me. They have my phone number. We've texted. I've called some of them. We email. I think as much flexibility as you can provide is important, because the stress that they're under, if they're back home, maybe they're taking care of family or siblings, or maybe working and they're unsure about how things are going to go. So I'm just trying to be as flexible as I can with accepting assignments. There's no late assignments at this point. There's just the ultimate deadline of the end of the semester for me. So that's kind of what I've been doing.
Gotcha. Okay, well, that's awesome. I mean, I'm sure they appreciate, your flexibility and your adaptability during this time. I'm sure that means a lot, for them on top of everything else that everybody's going through. So kudos to you. So what kind of real world experiences do you typically incorporate into your lessons or bring into the classroom?
Well, I worked in the clinic setting for just a little over 8 years. And when I first came out as a certified athletic trainer, the typical settings that you saw athletic trainers in were the educational settings, high school, college, university, and then professional sports. And then we started to see people venture out into outpatient sports medicine. And then all the venues started really opening up. We have students that work with mixed martial arts. We do have 5 graduates who work in professional sports. The majority of individuals still work in the educational setting, but they're all venues. We have people who are working in occupational health. One of our graduates works for Boeing, in physician practices, in hospitals, in high schools, in middle schools, pharmaceutical sales, fitness equipment sales, Hollywood, NASCAR. I actually got to do some experience with the SCCA race car circuit. I'm not a big race car fan, but I got to tell you, being just off the pit, watching the cars come in, for changes and stuff, that to me, that's the only way to watch a race. So,
New level of excitement, huh?
oh, absolutely. I use my experience. I use examples of what's happening currently in the different venue settings for athletic training, and what our colleagues are doing and what our graduates are doing to help our students understand the importance and the opportunities that they're going to have in different job settings.
Do you think, by doing that, that kind of makes a unique aspect to our program, when compared to others?
Oh, absolutely. I think one of the unique things about our program is, while we may not have all the bells and whistles, we are known for the individual clinical mentorship that our students get and the attention that they get. We specifically put in 5 clinicals, only 4 are required, but that 5th one is to provide students with an additional opportunity to pursue something that they think they want to do after they graduate. We had a recent graduate who worked with a local Cirque du Soleil troupe. We've had students work with ballet. We've had, like I said, students work in the occupational settings. So, it's just, we feel it's very important to provide variety for them and to show them that it's not just about being in the educational setting or acting as an athletic trainer providing medical care in the educational setting.
Gotcha. Okay, that's fantastic. So you hinted kind of initially coming to the university at the undergraduate level, but now I know we have the Master's in Science and Athletic Training that's a little bit newer. So I guess, how did that come about?
Well, when I first came to McKendree, the profession of athletic training was moving from a 2-model educational approach, which was internship and curriculum, to a straight curriculum approach, meaning that the only way that you could become certified as an athletic trainer meant that you had to go through an accredited curriculum program. So we achieved that status, and then in the last 5 years, with the research, and there's been a push as a healthcare provider, athletic training educationally has been both at the graduate level, the master's level, and the undergraduate. Well, we don't see that anymore for physical therapy, occupational therapy, physician assistant, etc. They're at the graduate level. So one of the things that we really felt was important as a profession and educationally as athletic trainers is that we needed to move our programs from the undergraduate level to the graduate level. So what we did was we phased out our undergraduate program and we started a brand new graduate program. And so we have the option for students. They can come in for the 3-2, what we call the accelerated program, which means that if you come in as an undergraduate McKendree student, as long as you meet all the minimum prerequisite requirements, for applications to the program, you're guaranteed acceptance. You could also come in as a transfer student, which could also put you in line for guaranteed acceptance. And then you could come in as a post-baccalaureate student just to pursue the graduate degree. And right now with our first class, we have a mix of students that are both accelerated and graduate students. We've just accepted our second class. And again, we have a mix of students who are accelerated and then students who are true graduate students.
Gotcha. Okay. Now, for those students that are transferring in, what type of programs would you suggest, they kind of do in their undergrad to make that transition to our program a little bit easier?
Well, just like physical therapy, occupational therapy, medicine, I mean, you as long as you complete all the prerequisite requirements, you could really have any degree. But what we typically see from students coming from the outside, and certainly what we built for students through the accelerated program, is our exercise science and sports performance. And so what we're seeing is the foundational knowledge that's required for athletic training in biology and chemistry and physics, anatomy and phys, and then other courses such as statistics, health and wellness, medical terminology, exercise physiology, kinesiology. Those are all commonalities that you'll see in programs all over the United States. And so for us, with the exercise science and sports performance, we've managed to, and what we really call it is ESSP plus. That is a coding term that we use for those students who are in the accelerated program. And so we've built into the major all of the prerequisite courses that they'll need. So it really makes it much easier for them to pursue the degree and then apply to the program. And then the combination in that fourth year of finishing their undergraduate courses and taking graduate courses at the same time and paying undergraduate tuition at that point, and we're crossing some of those graduate courses over to count for their undergraduate degree. So it really is a benefit for students who are considering that accelerated option.
Gotcha. Okay. So you talked about the clinicals that you have, and I'm sure those are interesting because, they actually get to have kind of some hands-on experience there. But what are some other interesting courses required in the program?
Well, I think it's all in the variety of courses is really determined by each institution. I think certainly one of the things that we're focusing on with our second year students, one of the courses they're taking this summer is health and recovery, which is an additional course about the rehabilitation process after surgery, after injury, coupled with maybe disease, but looking at really focusing on the mental and social aspect of the patient to make sure that you're treating them as a whole person. Other courses that we incorporate involve professional practice. Obviously, research is a component of what we do. Those are probably some of the more interesting things. But, I think what we really do, besides the didactic courses, is with the clinicals, is we try to make sure, what's interesting about those is that we try to make sure our students are getting a variety of mentorships with their clinical preceptors. So the first two clinicals are on campus. The one that this summer will be off campus in a variety of settings with physicians and outpatient clinical experience. And then they come back in the fall for collision. And then, like I said, that last spring clinical will be more about any pieces that they feel that they want to continue to pick up or that they want to concentrate more on. Something else that we use in our program is what we call shadow health. Our nursing counterparts in our school use it as well. And so there are a number of different virtual programs that we can use. And right now it's particularly vital because we're remote. And so even though our students can't be face-to-face clinically, they are enrolled in a shadow health course where they are participating in virtual medical assessment of different patients with respiratory conditions and cardiovascular conditions and mental health conditions, where they have to go through a full exam and assess, diagnose, and provide treatment.
Wow. Okay. That sounds very intriguing. I'm sure the students really enjoy that.
They do. I think initially it's a little odd for them, but I think one of the nice things about it is that it really does. It's very educationally oriented, and it helps them fill in the pieces when they're conducting exam. So, for instance, when I'm doing your history, if I don't ask a question, then the patient just sits there. So the patient's going to respond based on what I'm asking. And so it helps them refine their communication, their empathy, and then their overall evaluation performance.
Gotcha. So you have all the different pieces and parts to make them successful. So
We'd like to think so, yes.
awesome. Well, so I guess what are some of the coolest places you've seen your students kind of have these preceptors, or kind of different environments in which, they've been able to do their clinicals?
Well, we've had students do professional football camps. We've had them do dance camps. We've had students work at the minor league level in baseball. We actually had, when we were at the undergraduate level, 2 of our graduates who are still working professional baseball. They completed internships after they graduated, and that led right to their ability to get into the organizations. One still works for the Baltimore Orioles, and another one works for the Washington Nationals. We've had another graduate who did an internship during the summer with the Kansas City Royals at the Minors League, and then now he's working for the Kansas City Royals. We had another graduate from our undergraduate program who worked with a baseball camp, a whole bunch of minors when she was up in Washington State during the summer. And it was the first time that they had an athletic trainer and then had a female athletic trainer. So she actually got to write a number of the policies related to how to take care of injuries, the emergency procedures, and so forth with the medical director, because they'd never had somebody who was a healthcare provider who was with them all the time. And so it was a great experience for her.
Wow, I bet. So I feel like I may know the answer to this question, but what's your favorite part about working at McKendree?
I'd have to say it really is the students. And I love teaching, but the students do keep me on my toes. They're asking questions. And I don't always have the answer, but I'm like, okay, so we need to think about that. And even in my undergraduate classes, even if we weren't teaching remotely, I don't always teach the same class the same way every semester or every year that it's offered. It depends on the community of students that I'm with and what their understanding is, and their motivation and their engagement. And I think we have to be cognizant to recognize what's happening in our teaching environment and make those adjustments to help the students be successful.
That's great. Yeah, it's good that you recognize that. Do you have any words of wisdom for anybody, thinking about applying to our MSAT, or, interested in having a profession in athletic training?
Well, I think generally I'd say first that, my high school was bigger than the undergraduate school that I went to. And it was kind of a odd adjustment for me. In fact, I almost left because I thought that fishbowl was too small. I had to figure that out for myself. My parents did make that decision for me. And I decided to stay because I liked getting to know people. I still keep in contact with friends from college. The small environment allowed me to get to know my professors. It afforded me the opportunity to be able to go into their offices and talk to them if I was having trouble or I didn't understand something. So I think that's a huge strength of McKendree in whatever area you go in. I think another strength within the Division of Health Professions within the School of Nursing and Health Professions is that we have built a foundation of courses within our undergraduate majors so that let's say that I'm in physical education and I want to change to exercise science, or I want to change to exercise science plus, or I want to change to health and wellness. Well, you can change without losing any ground. Those courses, that foundation of courses is, a foundation for all of those majors, which makes it easier for students to maneuver. Some of those courses are also foundational when it comes to biology or it comes to biopsychology. So I think we've tried to build it that way so that there's some flexibility for students. In terms of the Master of Science in Athletic Training, I think that the venue settings for people to work are so wide that they don't have to be limited in their thinking in terms of it's only about being in the educational setting. It's only about being a faculty member or a faculty member providing medical care or just being staff providing medical care. There really is, the sky is the limit in terms of where you can go. One of the other things that is very exciting, I think, in the last 3 or 4 years with our profession is the recognition in terms of our salary. The starting salary for somebody with a master's degree is $46,500, and then it goes from there. So our salary pace, our benefits within jobs, our continuing education is keeping pace with the demand, and there's going to be a huge demand. There continues to be a huge demand for persons in our field over the next 20 years and beyond. So I think it's an exciting time for our students to be in the profession with the changes that have occurred in the last 5 years, the move to the master's level, the increase in salary, et cetera.
Gotcha. Well, those are great insights and great words of motivation. So I hope anybody out there thinking about it takes the plunge.
I hope so too.
Well, thank you. Right? Yeah. Well, thank you, again for your time and for talking to our McKendree family. And great thanks to all our worldwide folks that are tuning in and have been tuning in to our other videos amongst the series. So keep an eye out. We're going to keep putting them out. And then, as always, I am sending healthy and safe wishes to everybody out there during this time. And we'll catch you next time.
All right. Thank you so much for having me. I really appreciate it.
Oh, you're welcome. Anytime.
Take care.
You too.